back. It's time for Morning Rounds. It's National Endometriosis Awareness Month, a condition that affects 1 out of every 10 women in the nation.
And Dr. Jody De Lind is telling us about how it can affect the body and how we can stay better protected in today's Morning Rounds. Good morning, doctor. How you doing this morning?
Hi, good morning. Very well. So yes, endometriosis is a condition that's very common both worldwide and in the United States. It's a chronic condition where the lining of the uterus becomes implanted in areas outside of the uterus, such as the ovaries, the fallopian tubes, the bowel, and the peritoneum. And the peritoneum is the lining of the pelvis and abdomen. But it responds in a similar way to the endometrium, and so that tissue grows and sheds or bleeds in a cyclic pattern, and it can cause significant inflammation in the abdomen and pelvis, and over time can cause scarring, fibrous tissue, and adhesions. And I'll get into how that can relate to chronic pain and other conditions for women moving forward in this discussion. One of the risk factors for endometriosis is being nulliparous, or never having been pregnant or had a child, as well as low BMI or body mass index, as well as starting menarche or having their first period early in life, or being in menopause later in life, as well as having heavy periods and periods that are in a short duration from each other, so less than 27 days. So these are some risk factors, but any woman could have endometriosis, and so it's really important to understand what the symptoms are and to know when to present to a doctor, either a primary care physician first or a gynecologist, to discuss whether or not this is a potential problem for someone. Because of the scarring and the inflammation that can occur with this disease, over time, periods can become much more painful, and pelvic pain can begin within a few days prior to someone's cycle and then continue throughout their menses. And so women who have especially painful periods or have symptoms related to their menstrual cycle, such as pain with urination or pain with bowel movements during their menstrual cycle, these are some critical information for their gynecologist to know. Scarring to the pelvis and the ligaments of the lower pelvis with time can cause pain with intercourse, as well as scarring to the fallopian tubes can lead to infertility. And so there's some really long-term side effects that can impact someone's quality of life for decades to come if this is not identified and managed appropriately early on. So the important time to see a doctor is that if anybody has any of these symptoms or questions with regards to these symptoms, they should call and make an appointment and discuss whether or not this is an issue for them. Endometriosis is a very complex diagnosis, and it really requires multidisciplinary management. The earlier it's detected and can be treated, less likely there will be long-term. That's why it's so important for patients to speak up and ask with their doctor.
And doctor, I was actually diagnosed with endometriosis when I was 21 years old, and you know, you hear all of these things about how people find out when they can't get pregnant, and at 21 years old, it's really scary thinking that you might not be able to have a family later on in life. What do you have to say to those young girls who end up being diagnosed with endometriosis?
Well, the first part is that, you know, the first stages of management are conservative, and so it's taking away those hormonal fluctuations that lead to this continuous scarring to the pelvis, so that they're not in a position for having, you know, chronic scar tissue in their pelvis. The other is, while it can relate to infertility, at no point in time until someone has tried to conceive for at least 12 months should someone be given the diagnosis of infertility. So really the key is seeing, becoming comfortable and having those open conversations with a gynecologist early on, so that hormonal modulation, the use of birth control pills, or GRNH agonists that both work to decrease inflammation, as well as being on NSAIDs or non-steroidal anti-inflammatories. Those in combination are the standard of care and kind of the first line approach to managing endometriosis. When we have someone who does not respond to this and continues to have significant pain, that is when we'll resort to surgery. And surgery is really the definitive diagnosis for endometriosis, with the removal of implants and the lysis of any of that fibrous tissue or adhesions moving forward.
All right, doctor, thank you so much for your time. We appreciate talking to you about this difficult situation this Tuesday.
All right, thank you.
Thank you.
Have a good day. Jack's got
You
your
too.
forecast after this.